We're going to talk about diabetes today. Diabetes, lots of people have it, and it's epidemic. And I don't know if you keeping track of this sort of thing, but if you study it at all, you see we have an epidemic of diabetes. And why do you think we have an epidemic?
High fructose corn syrup.
Well, because the whole focus of, well, I won't say the whole. The majority of the medical profession is focused on prevention or treatment?
Treatment.
Treatment. Yeah, what's the Cancer Society and the Heart Association, the Arthritis Association? Do you ever see real focus on prevention?
No.
No, it's always, well, why is that?
No money.
That's right. You don't, if you prevent a disease, you, like we talked about heart disease the other day, just now. What's it cost? What's it cost to have a heart attack in Lane County? $1 million. See, so who's interested in preventing it? It's hard. It's hard to convert people because we really aren't really looking to help. We aren't really Christians anymore. We're more into making money. You got a question?
Well, I had a comment. When you said what's causing diabetes, I read an article, a documented article this morning about, which I knew about the high fructose corn syrup and all those kinds of things, but where I didn't realize that there's actually a chemical that they have put in bread for years and years and years called, I think it's called allotox or something.
Cytotoxins.
Huh?
Isn't it cytotoxins?
No.
Oh.
It's aflatoxin.
No,
It's not that one either.
It's like a chemical.
Okay,
that
and what does it do?
They purposely put in
To
white
make you
flour
diabetic.
bread, and it causes diabetes.
And I wonder if that's one of the complex carbohydrates the ADA, the American Dietetic Association, recommends for diabetics to eat.
Well,
I won't
this
answer
article was
that
about
question.
what is wrong with white flour. What are and it was talking about the things that people don't normally know.
Yeah.
And this was actually a like bromine that they put into bread. That was one of the things. But then there was these other chemicals that
Yeah. Well, our whole.
causes diabetes.
If you look at the big picture of our culture, much of it is designed to make people sick.
That's right.
So anyway, let's not have too many comments, or we won't get
No,
to.
a real short one, if you would.
Okay, let's see. Go.
Yeah. Speaking of the cost of heart attacks, the saying has been in the past that if you go in and are diagnosed with diabetes, the first, after you leave the office, the doctor orders a new BMW because of the cost. They're going to
Yeah,
get
I
that
don't,
back.
I don't know what the figures
Yeah.
are for treating lifetime treatment of a diabetic, but it's huge. It's big business. So the whole purpose of what we're trying to do here is to teach you how to stay away from doctors. And by that, you got to take good care of it. So just as a, for the heck of it, yesterday, I went through a bunch of books I have. One's about magnesium therapy. Let me read you what they say about diabetes and magnesium therapy. Subnormal neonatal, that's young baby, serum magnesium levels relative to the degree or severity of diabetes. So what determines the baby's magnesium level? The mother. So the mother's magnesium deficient, guess what baby's going to be? And what's that going to do to the chance of a baby, type 1 diabetes? It's going to increase it. I looked at here in a book about food allergies. Same sort of thing. A very fascinating thing. Let me just draw you a quick picture, and we're kind of jumping ahead here a little bit, but that's okay. These classes aren't real structured. Here's a cell membrane, we'll call it. Now, for insulin to work to lower your blood sugar, insulin has to fit into this little receptor site. That's way for all hormones. Let's say this is insulin, and it fits in here into the receptor site. Now, interestingly, we'll make another receptor site here. If you have a food allergy, frequently the antibody that your body makes to neutralize that allergic reaction from the food also fits into that. Let's say this is a beef antibody, and it fits in there too. So now what's going to happen to your ability to utilize insulin if you've got other types of antibodies in those receptor sites? you're going to have insulin resistance, and that's the main characteristic of type 2 diabetes, the type of diabetes those of us in this room would get. So we got this is an old book. This is a book that's been around for 30 or 40 years. But if any of you are diabetic, I would guess it's not very often that your diabetic doctor talks to you about food allergies. And here's a book about vitamin B6. What kills you if you're diabetic? Blood sugar levels? What does it? It's the complications. You go blind. You have heart attacks. You get amputation because you don't get circulation to your feet. You get infection. The Chinese call it the death from 1,000 cuts. This doctor was a B6 doctor. He took all his diabetic patients and put them on a generous dose of vitamin B6, 100 milligrams or something like that. I can't remember the dose. The recommended daily allowance is probably 2 or 3 milligrams. He put them on 100 or so. And he was following the blindness aspect of diabetes. And it's pretty miserable if you go blind, and then you get surgery on your eyes, and you get, anyway. On all of his patients, there was no progression of the eye lesions, and there was some improvement just with vitamin B6.
Wow.
Now, what if you combined that with extra magnesium and you dealt with the food allergies? What would happen to the complication rate? And if your eyes are getting better, the vascular lesion in your eyes is getting better, are they getting better? What would be happening to the vascular lesions in your feet and in your kidneys? The other complication, you get kidney failure, you get high blood pressure. Because vascular changes in diabetics are not confined to the eye or to the feet. They're take in all of your vasculature. So there's just two examples, food allergies and magnesium. Well, let's back up a little bit. Let's stick to the program a little bit. Did y'all get a handout? You got something to look at? Okay. Yes? Okay. If you didn't get one, there should be some over there on the table. Are we down to the last one? Well, you guys don't sign up for classes. I guess I just get 20 handouts every day. 6 people.
You want to run next door and ask her to make one?
She can't. Our copier's broke. So you have to share. Anyway, if someone really wants one, let me know afterwards. We'll get some more copies made. Okay, the basics. What? Someone give me a real primitive description of what diabetes is. Come on,
Insulin resistance.
Well, insulin, that sounds nice, but that isn't what you don't go to the doctor and get measured for what's your insulin resistance level. No, you don't. How does it show up?
It shows up in high glucose levels in the blood
Yeah.
over a prolonged period of time.
Yeah, your blood sugar goes up.
Yeah.
And your urine sugar goes up. In the old days, how they test for diabetes? They tasted your urine. In fact, one book they call it holy urine because it tasted good. It was sweet. That's because your kidneys can't reabsorb the sugar or the little holes that your urine gets filtered through. They get too big, and so sugar molecules can go through because there's been damage to the kidney, and so they start leaking. Another hallmark of diabetes is protein in your urine. Now, there's always a little bit of protein, but when your protein levels start going up is an indication that your kidneys are starting to fail. It's almost always in diabetes is because of a vascular lesion. And someone described those vascular lesions when, maybe I can find it quickly. Okay, no, that's not what I wanted to read. Anyway, what it describes is when you have high levels of sugar and insulin over a long period of time, it changes the nature of the protein in your blood vessels. Now, what happens, what does your body do when the nature of a protein in your body changes?
Tax it as being foreign.
Yeah, it's a foreign body. Your body doesn't recognize it as you. as blood vessel or a kidney or muscle or joint or so what happens when your body recognizes that something in you is not you? Yeah, you get an antibody, you get an allergic reaction. And then we have what we call autoimmune disease. And so nowadays, some major thinkers are saying diabetes is probably an autoimmune disease, which adds to that list of autoimmune diseases, which is growing quite rapidly. So all sorts of things. So what is it that raises blood sugar? We got 3 food types. Someone name them quickly? Carbohydrate, protein.
Starch. Well, sugar.
No, starch and sugar and carbohydrate are all the same thing.
Yeah.
What's one more? Come on, stay away from it. Don't eat it. Bad, kills you.
Fiber. No.
Fat?
No, fat's the big boogeyman over the last 30, 40 years. And now he's kind of coming back in, the old pendulum. It's terrible for you. Oh, no. Even Time magazine had it on the cover, big strip of bacon a while ago. So it's come full circle. So fat. Now, which one of those food groups will raise your blood sugar? What's blood sugar? Is sugar a fat or protein or carbohydrate?
Carbohydrate.
It's carbohydrate. And when we talk about simple carbohydrates, it means some of these carbohydrates, they're just carbon molecules, and they can be hundreds of carbon molecules long. And that's what we call digestion. You eat a carbohydrate, and your digestive system breaks it up. And that's why we want complex carbohydrates, because your blood sugar doesn't change. Your blood sugar is a 6-carbon sugar, and until the carbohydrate is broken down into a 6-carbon molecule, your blood sugar doesn't go up. Now, I don't know if you saw my email a few days ago. I put fruit juice in there, a list of different fruit juices, and how many teaspoons of sugar. We kind of tend to think sugar is, juice is, hey, that's pretty good food. Orange juice for breakfast, that's pretty good stuff. It's not. It's sugar water. Almost all fruit juices are sugar, and they have as much sugar as a can of pop. And so when you send your children to school, I'm talking about when you send your children to school and they get free lunches, they're getting sugar water and then a cinnamon roll. We call that, that's worse than worse than going hungry, I think. But anyway, what raises your blood sugar? Well, simple carbohydrates. Carbohydrates raise your blood sugar. And when your blood sugar goes up, I better get another color here. Your blood sugar's going along here like this. You're pretty happy. Then it goes down a little bit and you get hungry, and so you eat something. And then your blood sugar should go up a little bit. And that's what's healthy. And that stimulates the right kind of release of hormones and adrenal gland cells. But when we eat simple sugars, it gets absorbed very quickly and your blood sugar goes way up. That's stress. Whenever your body goes from one level to another level in a hurry, your body senses that something's wrong. And so we have a stress reaction which releases cortisol, releases a whole lot of emergency hormones. Okay, so we've got that much. So we want to avoid the basic underlying principle in the prevention and treatment of diabetes should be what? What's the main the dietetic principle that we should follow?
Stop eating sugars.
Well, okay. Let's say I cut down on my sugar intake. What's a bigger, a broader recommendation that we should consider? Fewer carbohydrates, the source of blood sugar. Now, your body can convert fat into sugar, and it can convert protein into sugar, but that's a long process. It takes time. Excuse me. At the turn of the century, or the first part of the 21st century, the American diet consisted of about 65% fat. A lot of calories from fat. but we didn't have all these chronic diseases. We had infectious diseases for a while until we learned what caused those. But we didn't have this diabetes. Now the rate of diabetes is doubling almost every few years. It's an epidemic. It's good for business. So generally speaking, lower your intake of carbohydrates. Unfortunately, according to Dr. Tanton and his great, if you're diabetic or if you know someone that's diabetic, one of the best things you can do is maybe give them a book like this. Now there's others. Julian Whitaker wrote a good book about diabetes, but I like this one because it really helps you understand all the different ramifications, how it relates to your adrenal gland, how it relates to your thyroid, how it relates to intestinal permeability. Food, it's really a good comprehensive book. It's easy to understand, and you see what's the relationship between Prozac and diabetes? Anybody ever thought of that? Anyway, there is a relationship.
That is a real good book.
It is.
That is
It's a
very
good
good.
book, and you can get online.
The
and
trick is to get them to read it.
Pardon?
The trick is to get them to read
You
it.
can,
especially
but at least you
the-
can give it to them. Yeah, and if you don't give it to, I think for the most part they really have very little chance of really overcoming this, because they're going to go listen to the usual routine, and unfortunately, as Dr. Tanton points out in here, almost every recommendation by the establishment makes your diabetes worse. Unfortunately, that applies to the few other medical specialties, but we won't take time to name them right now. Okay, so it's a great book. Okay, so the categories of food, carbohydrate, protein, building. We need protein in moderation. It's really, remember the food pyramid? What's the base, the foundation of the old food pyramid? What was it?
It was grain, I think.
Carbohydrate.
Carbohydrate, yeah.
Yeah, and they gave lip service to complex carbohydrates, but it's mainly carbohydrates. Now they're saying, oops, we have this food pyramid that's been pushed on us by the government, and now all of a sudden, gee, maybe it has something to do with all this chronic disease we're experiencing. So now they've at least tipped it on one side, and the carbohydrate isn't quite, and they've given a little more lip service to fat intake. They still haven't distinguished between good fat and bad fat, but it's progress. Okay, fat, fiber, and okay. Now there's all sorts of supplements out there. Basically, as I tried to mention when I brought up these various books, is that diabetes, like almost every other chronic disease, is a form of malnutrition. And unfortunately, most of the medications, as Dr. Tanton points out in his book, according to a list, now this isn't just his opinion, this is stuff that he came up with by reading package inserts. Quote, for instance, according to a list of the top 200 most prescribed drugs on the market, over half, at least 100 of those drugs, listed either diabetes, hypoglycemia, or blood sugar fluctuations as a potential side effect, or noted that taking the drug would worsen the condition or interfere with its treatment. Half the drugs you're being prescribed, if you're being prescribed drugs. And what does that tell you? Why does that happen, do you think? Why do those drugs do that?
More money?
Cure.
Pardon?
They're not for a cure.
Well, they're not for the cure, but why? What's the cure?
Your diet.
What's, diet, well, it's not very specific.
Well,
The
a
nutrients.
clean life.
It's lack of the nutrients. And your diet is right, because most people eat a nutrient-deficient diet. But these medications increase your need for these nutrients. And if you already have a deficiency causing the disease, and you take medication that gives you, see, it may make the numbers look better, and that's the definition of a drug, remember? Something that makes you feel better and the numbers better while you get worse. Ken, you had a comment?
Well, aspartame, severely aggravates diabetes.
And we'll get to that in a minute. Yeah, we'll get it. He goes on to say, talks about some other drugs. On that same list of drugs, out of 180 prescribed medications, been evaluated, 164 were found to deplete the nutrients necessary for controlling blood sugar, or nutrients that can potentially result in diabetes or hypoglycemia. Thus, more than 91% of the medications tested for nutrient depletion created deficiencies responsible for contributing to or are involved in blood sugar regulation.
Wow.
So that's why you've got to take responsibility. See, from my perspective, and you know, I'm the sour grapes guy, because medical schools train doctors to become drug dispensers, because the people that finance and continue to support the medical schools and the medical journals that all the doctors are trying to get published in so they can stay, you know, in academia, these people are the ones that control the curriculum of the medical schools. It's frightening, but it's real. And so you've got to take responsibility. If you're the doctor says, oh, your blood sugar's going up a little bit, you better lose a little weight and exercise more. Those are good recommendations, but it's not nearly enough. You're still probably going to become diabetic unless you learn more than your doctor knows. When we talk about hypoglycemia or hypothyroidism or thyroid deficiency, your doctor isn't going to help you much unless you happen to have abnormal blood tests. You've got to take that responsibility. And it's scary. But you aren't going to get the help. But you can go on the internet. You got books like this that'll coach you. And most of the time, if you use a little common sense, let's say, for example, you're diabetic and you're on insulin, you're on medication, and you want to get off it. You can monitor your blood sugars. You can keep a journal. You can watch and make sure what's happening isn't going to put you into a diabetic coma or a hypoglycemia. You can monitor that because there's just all this information available. But it's a little bit scary because you've been grown up to think, if my doctor doesn't tell me to do it. You know, I read a quote here recently. One of the hardest people to educate. What group is the hardest group of people to educate?
Doctors.
How do you know that? How do you know the answer to that? That's exactly what someone said here. I wish I don't know where I marked. Too many marks in my book here. Doctors are the hardest people to educate, or nurses, because they know too much. They're too smart.
They become indoctrinated.
Indoctrinated.
True.
Yeah, well, that's right. They go through medical school, which is hard to get into. So all of a sudden, I'm in a select group. You know, the top 5% of them in college get into medical school, which is probably a mistake. But then you get through that, so you're obviously pretty smart. Unfortunately, you aren't very wise sometimes. But anyway, so you've got to, sure, bounce this idea off your doctor. But one of the hardest things to do is when I make a suggestion, as I used to when I was practicing, make a suggestion to someone. The first thing they may say is, "Well, I'll go talk to my doctor about this." And you know you've lost it. Because you know the doctor would probably disagree because either he doesn't know anything about it or his ego's a little too large, and if he didn't suggest it, it's not worth suggestion. Anyway, back to diabetes. Okay, so I made a list here of things. We talked about sweeteners. Let me read on the second page, I think it is. No, I guess yeah, okay, the bottom of the second page. Aspartame.
In everything.
Pardon?
It's in everything.
A lot of
Well,
things.
it's not in a baked potato.
No. Did you look at any
Oh,
kind
I
of-
know it.
If you read on the,
My daughter she likes to chew gum. And I've told her, if you want to chew gum, you can't have aspartame in it. And she can't find gum. We get xylitol gum occasionally. but she can't, and I love it, because she can't find gum. And she's kind of agreed with this idea. I've told her, no, if you read the book,
Any kind of diet, colas or diet,
oh yeah,
whatever.
no need diet.
All of
If you
that
read
stuff.
this book called Excitotoxin, here again, we're talking about diabetes. Let me read this. Another interesting finding is that glutamate, well, this is about MSG, but it's in the same general category of aspartame. They're excitotoxins. And they overstimulate your brain and your nervous system. It can unmask diabetes in mice that are genetically susceptible to the disease. Now, many people saw the idea that if your mother has diabetes and your uncle has diabetes, you're going to get diabetes no matter what you do. That's a myth. The topic of nutrigenomics, the study of, is the expression of genetic abnormalities, expression of any of your genes. It is influenced by your nutritional status. Yes.
There's also scientific information out there about the polio vaccine.
Let's not get started on the vaccines.
Well,
There's probably aspartame in the vaccine. There's MSG in some vaccines. But this person goes on to say, now this is written by a neurosurgeon. It's not just some book I picked up at the checkout stand. It's called Excitotoxin by a guy named Blaylock, B-L-A-Y-L-O-C-K. He goes on to say, well, I did read it. It can unmask, so what you feel is genetic predeterminism is not. It goes back to this old argument, is it in your nature, is it in your genes, or is it what you learn to do, your learned behavior that causes the expression of this problem? So you can change your history.
Oh, that implies individual accountability.
Oh, yeah. Well, here again, that's the whole thing. That's the whole thing, individual accountability. Well, let's read what Dr. Blaylock, the same guy. Weight of evidence is overwhelming. If you want to avoid obesity, metabolic syndrome, which is another term for diabetes, neurodegenerative diseases like MS and ALS and Parkinson's and cancer. And if you don't want to make your cancer more aggressive, then you need to stay away from these products. That's not too ambiguous, is it? I mean, that's pretty straightforward. But like you mentioned, you have to be aware. You've got to understand all the different ways they put those things in and maybe a slight variation. Does that mean sucralose is okay? What's an artificial sweetener that I might agree to?
Stevia.
Stevia. In fact, stevia is one of these things that actually makes your cell membranes insulin sensitive. So stevia, I think, is a bonus. And it's pretty natural. It's just ground up leaves. And it tastes pretty good. Some people don't like the taste, but if you need something sweet, try stevia.
Lohan.
Pardon?
Lohan. Lohan is a Chinese fruit.
Okay, yeah, there's several out there that tell your taste buds it's sweet, but don't change your blood chemistry. And don't do this excitotoxin routine. Okay, so then the other quote, taking my diabetic patients off aspartame led to an immediate improvement.
That's right.
These aren't ambiguous statements. These aren't questionable things. These things are there. But if you read the diabetic literature, they almost focus on getting you onto those things. I'm not totally up to date on the current ADA protocols, American Dietetic Association protocols, but I know in the past that they focus on those things because they don't want you to have to go without your sweets. And then one more, B.H. Roberts wrote a whole book on aspartame. Can precipitate diabetes, stimulates and aggravates diabetes, retinopathy, that's where you're going blind, and neuropathy, that's when you get... Has anybody here experienced peripheral neuropathy?
My aunt.
It's awful.
I
I mean, a friend of mine described it as ants crawling on your legs and stinging you. And so what do? What do they put these people? And he couldn't give up his diet Pepsi.
Oh,
So he took Lyrica, which is, I think, the usual recommendation for the neuropathy. Anyway, he's not going to get better. And so he's going to keep buying Lyrica until that doesn't work. Then they may end up, I don't know. So this is pretty. If you go on the internet and look for aspartame side effects, you see it's 2 or 3 pages long. So when in doubt, stop aspartame. Maybe things will get better. Okay, back to page 1 now. On the bottom of the first page, I've got a list of supplements for stabilizing blood sugar levels. And see, this should teach us that your blood sugar levels would be stable if you just ate wholesome foods. I mean, if certain nutrients if vitamin C makes heart disease better, what does that tell you about prevention in vitamin C? It should tell you a whole lot. So some of them are the usual vitamins, minerals, and A, C, D, and you can go into this literature and you can find all sorts of peer-reviewed medical literature that supports this stuff. Ken?
is there anything besides ascorbic acid that gives you a much more natural source for vitamin C, besides your, fruits and stuff? Is there any supplement that's got a concentrate or something besides ascorbic acid?
I mean, besides vitamin C, are you talking
Vitamin
about?
C is the primary source for it is ascorbic acid, although some of them say, well, we've got a few other sources that are natural, but ascorbic acid.
Well, the sources, I think they mean where did it come from?
Yeah.
Sago palm or is it synthetic, ascorbic acid or something
A lot
like
of it
that?
now is synthetic, isn't it?
Well, a lot of it is, but that's what Linus Pauling developed his theories on, so it probably works pretty well. I think you're probably right. If we get these nutrients from food, but because of our environment and because of our family history and our diet when we're in the first 40, 50 years of our life, it's very difficult to get enough of it out of our food anymore. Plus our need is much higher because of pollution and all these other things.
I've been doing some research in health and readers now for liposomal vitamin C, and
She has a statement about liposomal vitamin C.
and I tried the sodium ascorbate with that. For me, that caused a definite pH imbalance in my body.
Okay.
But Dr. Blaylock recommends magnesium ascorbate.
Yeah.
And then also the lecithin, I don't prefer to use the soy, and so you can get sunflower lecithin to encapsulate
Well, see, that-
magnesium ascorbate with.
See, what she's saying, her individual variabilities. There's very few things that I say or the books say that they're all going to fit you. You've got to do what she is doing and find out what works best for you. Now, for a lot of people, ascorbic acid works well. Now, the liposomal ascorbate is felt to be much more readily utilized by you, by most people, but some people find they do just well on magnesium ascorbate or sodium ascorbate, or there's all these variabilities, and that's why you've got to find out for yourself. Some people are very sensitive. I've found that if I take baking soda on a regular basis, I don't need nearly as much vitamin C. Whereas before I might need 8 or 10,000 a day, if I use my baking soda twice a day, and it's very interesting because you read the literature, you find that if your body is more alkaline, you lose less magnesium. And it's obviously there's some relationship between magnesium levels and need for ascorbic acid. See, it's beautiful, but it's very complex. But all these things you've got to find out for yourself. And you're all practicing dowsing, right? Blank stares. If you don't practice dowsing, you're going to waste a lot of time and money. If you don't develop your skill at dowsing, you're just going to spend a lot of time struggling. take you a lot longer, and you'll spend a lot more money, and you'll have a lot of bottles in your vitamin closet that you never use. So anyway, it's an individual thing. But if you look at these things, you know, there's mangosteen and goji, and these are because they have the nutrients in them. Chromium increases insulin sensitivity. Vanadium mimics insulin. Iodine. Well, we'll talk about thyroid in just a minute. Cinnamon naturally contains many of the nutrients needed for blood sugar control. We should all be taking cinnamon. You know, it's cheap, it's and it tastes good. We have a little, you know, I don't like to be too personal. We make applesauce frequently. It's my bullet. You cut the whole apple up, seeds and all, skin, and I know I'm getting some pesticide. You can, but I add cinnamon to it. We put cinnamon and vitamin C in it, and everybody loves it. And you get the seeds, which increases the. So I figure the seeds neutralize the pesticide anyway. Maybe I just keep thinking that maybe it'll work.
It's good in your
Wash your
smoothie.
apples with hydrogen peroxide. and
We
stuff.
try. We do that.
But again, your organic apples, no, not as much money as they used to be. Like, you
Well,
get
they're not as much money, but they're usually twice as much as,
Yeah.
you know, and you know, $3 a pound for apples, kills you.
Well, organic apples in Salem are a buck, for some of the organic apples are $1 a pound.
Well, but the gas to get the Salem back,
Well, they gotta be, they can't be.
I know they probably do in my shop. But anyway, we're not talking about pesticides now. We're talking about cinnamon. Okay. Amino acids. Okay. How many of us supplement amino acids? Great. Okay. See, when we don't digest our food efficiently, like I'm sure none of us do, and we don't have a healthy gut environment, like I think very few of us do, then we need supplement. We need help because we aren't breaking the food down thoroughly to get the nutrients out of it. And every one of you that has any gray hair, is over 40, probably has a digestive problem, a digestive inadequacy. It's almost universal. So you need to think of these things.
For those digestive enzymes, someone was saying something about live ones versus just standard ones.
Live enzymes?
Live probiotics or something?
Oh, live probiotics. Probiotics are different than enzymes.
Okay.
Yeah, we want live probiotics. Dead canned sauerkraut doesn't do you much good. Yeah. Okay, coconut oil.
I said 140,
Pardon?
Oh, he was asking me a question.
Okay, coconut oil is superfood, I think, because it has several beneficial effects. Number one is brain food, and it'll help keep your brain functioning well. Number two, it has an antibacterial, antiviral, anti-parasite function in your gut. Like last week we talked about other healthy saturated fats also have some of those characteristics. But it helps you regain the balance in your intestinal tract, clean up your environment down there, that allows it to be more efficient at breaking your food down and manufacturing the vitamins and minerals that help control your diabetes. So coconut oil should be right next to your cooking area. It's really good stuff.
Yeah.
Progesterone.
I cook with it all the time.
Yeah, and the other thing is progesterone. And it's very interesting, since most of us are estrogen dominant because of the environment and our diet and our history, estrogen diminishes insulin sensitivity. And progesterone increases insulin sensitivity. And so probably most of us should be supplementing some progesterone. Testosterone is another way to increase your insulin sensitivity. Okay, moving right along. Now, let's get to thyroid. You read the thyroid books. Oh, Dr. Starr wrote a book about, he called it Hypothyroidism Type 2. Now, he wrote it that way, I'm sure, because he wanted to emphasize that many people, and I'm not sure of the percentages, but many people that have thyroid, a need for thyroid, it isn't because they lack the hormone. Just like in type 2 diabetes, most people have plenty of insulin, even though they end up needing insulin shots, because they've lost their ability to react healthy in a normal way to the hormone. Now, when I drove earlier drew this cell membrane up here, one of the reasons we're having trouble, one of the many reasons we're having trouble with a cell membrane is really a layer of 2 or 3 layers of fat. Now, one of the major contributors to degenerative disease is bad quality fat, trans fats, and these vegetable oils that we cook with that denatures them, and so we don't get the healthy fats we need to maintain and repair cell membranes. Now, another important component of membrane repair is a chemical called, I'm a boogeyman chemical, cholesterol. And I don't know what the numbers are, but I'm sure a growing number of our population is on cholesterol-lowering mechanisms, on medications. Not only do those medications block your formation of cholesterol, they block your formation of other chemicals that go into the rebuilding of cells when your cells normally divide. If you can't reproduce your cells healthy, we call that a mutation, and what does that increase your risk of? Cancer. So the statin drugs really increase your risk of cancer and dementia and a few other things. They're bad. It's bad science.
And it doesn't help your heart at all.
Only if you
From
believe
having a
cholesterol
stroke.
causes your problem. Remember that little ditty I put in the newsletter yesterday? Science in the hand of government is bad. Bad science in the hands of government is dangerous. And bad science in the hands of bad government is sinister. Is the CDC science the government? The CDC, anyway, you distract me. Anyway, type 2 diabetes, because people, number one, they aren't responding to the hormone. You almost universally, in fact, the professor at the medical school told me, if your TSH level, which is a measurement of how much thyroid stimulating hormone is in your blood, if that is normal, you never, very dogmatic, you never need thyroid. He's wrong. But he's medical school, so he's teaching these very smart doctors what they should think and believe. You can have plenty of hormone there, just like the diabetics do, and you still aren't getting what you need. So let's see what he says here about diabetes. It's a whole chapters. Whole chapters about the relationship between diabetes and hypothyroid, thyroid hormone deficiency. I don't like to say hypothyroidism because that suggests that the gland isn't working. The gland can be working just fine. But if your cells aren't responding to it, doesn't do. If your gas tank is full but you've got a bad carburetor, do you get where you're going? No. You got a bad fuel pump, you get where you're going. If your spark plug, there's all these things that can happen to your car, and if the mechanic just look at the gas gauge and charge you, what do you say? Take your car, my car's not working. Well, he turns on the ignition, hey, you're fine, you got plenty of gas. And that's literally what doctors do when all they do is measure your TSH, your T3, or your T4, your thyroid peroxidase, and that's all they're doing is looking at the gas gauge. You've got to be smarter than that. And if you are doing your homework, you'll know. If you think you may have thyroid problems, and 80% of the population have thyroid problems, I'm guessing. Yes.
I was told with the TSH by a hormone doctor that if your TSH is high, which mine was, then they couldn't figure out why. Well, just don't take it.
So-
That's the God's truth.
Yeah. Now, I don't, we kind of badmouth doctors. Most doctors are trying. They have good intentions. Most go into medicine because they want to try and help people. But once you get in the system, it's tough. And I don't know if you noticed a while back, a whole bunch of doctors quit Peace Health. And that's because the business manager tells the doctors, you've got to see 8 or 10 patients every hour. And they're going to schedule them. And, if you've ever been into a system where you have appointments and you try and keep on schedule, and you spent the 15 or 20 minutes you're allotted for that, well, if you have 6 to 8 patients a day, an hour, you don't get that much time. And so you can't even say hi, because that takes a minute or two. And so doctors it's a real dilemma for most doctors. But anyway, you've got to take responsibility. Yes.
I was just gonna say, like you said, the doctors are caring people that want to help people, but they have committed to a belief system.
That's right.
And
it's
their
too
belief
scary.
system-
They're in that system, and it's scary to get out of it. Yeah.
Well,
They
they're
put
manipulated.
10, 12, 14 years of training. Anyway, but so you can take responsibility. You can do your basal temperature test. You can take iodine. You can take thyroid. You can take that responsibility. It's very, very safe. It's safer than most medication you get at most drugstores. And it will not, going back to the first part of our little talk here, it will not increase your need or increase your risk of diabetes. In fact, if you read what these doctors say, it dramatically reduces your need for insulin if your thyroid's functioning properly. Because thyroid is the little fuel for the metabolic engine inside your cell that utilizes thyroid hormone.
That's why the temperature, you can pick it up by reading a low temperature.
That is one of the best ways. That's where the pioneers in this area felt there was a reliable. Then you don't use that in isolation. But if your basal temperature is low, that's a very high index of suspicion. But you look for other symptoms, and it can be depression, it can be dry skin, it can be menstrual problems, it can be losing your hair, it can be constipation, it can be joint pains, it can be high blood sugars. So because it affects every system in your body. So one of the first things you do, my little mantra is quit gluten. And then you do your basic temperatures, and then you take a few vitamins, and a whole bunch of things will get better for you, things like that. But thyroid is critical. Dr. Barnes, one of the pioneers, found that it was the reason people get heart attacks. Because, see, it's fascinating. It really is all interconnected. But if you, here are your hormones down here on this little schematic. And up here is cholesterol. Cholesterol has to become hormones. That's how your body makes hormones. Now, but before cholesterol can be converted to the hormones that precede your other hormones, you've got to have what? You've got to have thyroid, you've got to have vitamin A, and you've got to have magnesium. Those, and other things. But those are the crucial nutrients. So if you've got high cholesterol and you're low magnesium, is the answer statins? No. No. Is it more exercise?
Yes.
No.
Well, it should have it.
It's take these things first, and maybe that won't work. But what's the risk? What are the consequences of taking magnesium and vitamin A and thyroid? Phew, you'll get better. I mean, magnesium, vitamin A, and a little bit of thyroid. Or maybe just iodine. So it's critical for pre-diabetics and diabetics to take these nutrients. And then, of course, you add the B6, because like Dr. Ellis said, B6 is critical for healthy capillary integrity.
You haven't commented on Dr. David Brownstein is specialized in thyroid and salt.
Well, he's an iodine man.
Yeah.
Yeah, iodine is another critical nutrient, because you have to have thyroid hormone is basically a molecule of an amino acid plus 3 or 4 iodines on it. And that's why you want to stop fluoride, because fluoride interferes with all these things. It increases your need for insulin. Fluoride's poison. And the bulk fluoride comes in a container that says what? Toxic sludge. So you read the labels, because they put it in there, they don't say this soda pop was made with fluoridated water or chlorinated water. And chlorine's another molecule that can't really avoid that very well, unless you have a well or something like that. But if you take enough iodine, you'll increase your excretion of the minerals that compete with iodine: chloride, fluoride, and bromide. The best way to get rid of your excess fluoride, and there aren't very many good ways, is beef up your iodine intake. Now everybody's afraid of iodine. Everybody says, oh, the recommended daily allowance is 1 milligram or 1,000 micrograms. I think they put it in micrograms so it makes look like you're getting a lot. But 1 microgram is 1,000th of a milligram. And so if they put 1 milligram, it doesn't look like you're getting very much. But people are treating serious conditions with 50 milligrams of iodine. And one of the many benefits of iodine is that it neutralizes estrogen. And since we're all estrogen dominant and we're all iodine deficient, I think almost everybody should be taking 5, 10, 20 milligrams of iodine. And then you watch your symptoms. You know, you're real cautious. So you say, I wonder if this has anything to do with my blood sugar level. So I'm going to increase my iodine intake. Well, fine, be cautious. Go to 5 milligrams, or go to 10 milligrams, and just watch your symptoms. Learn how to take your blood sugars. Yes.
In the stores, I'm seeing more Costco, grocery outlet, these little packages of kelp. They're little wee thin strips of them, and they're apparently just piles of iodine.
And what do they test?
Well, they're for kelp. They're
Oh yeah,
sheets.
kelp. Well, because the iodine's coming back in. But kelp is better than. But if you've been eating kelp all your life,
Yeah.
great. If you live in Japan or China and live by the coast and been eating kelp and seaweed as a condiment all your life, you're probably okay. But adding kelp to your diet at 50 isn't going to give you the benefit. And here, like Linus Pauling's always said, it's the right stuff in the right amount at the right time, orthomolecular. And people frequently do that. Well, I'm taking iodine. It doesn't make any difference how much you're taking. Well, I take 50 micrograms twice a week. You know, that's good, but it's not gonna fix you. And here again, we get back to dowsing, and you really need to learn to douse. You really do. Yes.
50 milligrams of iodine, how many drops is that of the Lugol?
Well, if you get 2% Lugols, which is about 6 milligrams per drop, if you get 5% Lugols, isn't it? It's great. You can buy Lugols now without a prescription.
So 8 drops.
No, that'd give you, yeah. You go online to jcrows.com, or just you can Google it. How many drops of, how many milligrams of iodine are there in a 2% Lugol solution, and just put the search on. It's amazing. Yeah, so you can calculate that. Some people treat metastatic breast cancer, and I think breast cancer and prostate cancer are very, very similar biochemically.
So I've only been taking 1 drop, thinking that
Well,
was
it's
plenty.
better than what you were doing, but
Yeah.
it's probably, here
But
again,
I can up
test
that,
it.
yeah.
Test it. I don't want to venture and try and tell you what you need as far as dosage go, so you test it. But people treat it with 50, 100 milligrams. 50 to 100 times the recommended daily allowance. Recommended daily allowance is the amount that would probably keep you from getting a goiter if you start taking it when you're 1 or 2, and your mother took it.
So if you're not going to eat enough salt to get iodized
You're
salt,
never gonna get enough out of iodized salt. Never.
The salt would do you more harm than.
Well, no, it really wouldn't. You get good
Sea
salt.
salt's
I
okay.
started taking some of the drops of the iodine the last time I was here. But anyway, I finally got gutsy enough to bump it up to 3 drops a day.
Wow.
Yeah, I know. And finally, anyway, I got that metallic taste in my mouth
Okay.
that we've heard about.
Uh-huh.
So I just backed off a little bit.
Yeah.
But I'll tell you, there's no mistake about that. When that gets in your mouth, you're trying to spit it out and you can't.
Well, I have not had that problem. I can put it in water. I can put it my daughter, I want her to take some, I put it in her food, she doesn't even notice it. I don't think I can taste it in a little, I put it with my baking soda, I don't, if you do, then, I don't know.
Well, it was just that one time, what I did, I had to take like 3 drops for like 3 days in a
Well,
row.
that's good, and we should be aware, if you're gonna
Then I
take some.
backed it down,
Yeah,
just a little.
well,
2
okay.
drops.
So
You can get
anyway,
it in pill form.
pardon?
You can get it in pill form.
Yeah, you can get iodorol or iThyroid, you can get pill form and just swallow it.
Right.
But some people like the drops, and it just kind of depends on your preference. But it's widely available. We have no excuse really anymore, except ignorance. Okay, on the back of the first page, I've also put some other items, so just sort of some reference stuff. If you think maybe if you've got rheumatoid arthritis, you've got something else that makes you think maybe you have an autoimmune problem, then you ought to look into naltrexone. And I gave you a site there. You can look it up. It's amazing stuff, and since most of us probably have some degree of autoimmunity, then I think it's probably something to think about for just about all of us. Now, here again, when you decide you might need naltrexone, and if you find you want to try it, you don't need to take these things every day. And then some people make the mistake of thinking, well, I need it, so I better take it every day. Well, you might need it once a week or twice a week, who knows? But the only way you're going to get an answer to that is to learn to dose. Okay, here's an online source of thyroid, antiagingsystems.com. You get thyroid and naltrexone there, and a whole lot of other things. And they send you a nice little magazine once a month with usually a very interesting article in the front, and it's just their catalog. But it's a good source. It only takes about a week to get the stuff. Comes from overseas. Comes from Great Britain, I think it is. The other thing is, I think I'm guessing, but I think if every diabetic went on the paleo diet, 50% of them would be normal, would be well. Now, it may not reverse all the complications that have developed, but I think it would make a significant impact on the progression of their complications. So if they went on the paleo diet and, for example, took extra magnesium and B6 and cinnamon, who knows what would happen? But if they don't do those things, you're going to see the progression of these things. We don't know how rapidly they were going to progress. Okay, and another thing you might want to think about is urine therapy, and there's a great book, and you can go online and Google that and get a lot of information about the benefits of urine therapy. Type 1 diabetes is a situation where kids get it. And here again, they're seeing a relationship between vaccinations and diabetes. Now, of course, we don't talk about that in polite circles, but it's there. And who can you trust to get straight information? And this whole vaccination thing is going in the direction of more and more compulsivity. Even though, have you noticed that who gets blamed for the outbreak of measles at Disneyland?
People who aren't
The
vaccinated.
non-vaxxers.
Yeah, the people that didn't get vaccinated. Now, wait a minute. Let's try to be a little logical. If vaccinations really work, why do people get measles? They've been vaccinated. They wouldn't.
Why are they even afraid of people that are not vaccinated?
Pardon?
Or why are they even afraid of people that
That's
are
right. Why are we afraid? Why do we have vaccine? I got my vaccination. I don't care if you have measles or not. I've been vaccinated. Really, if you're really interested in the vaccine situation, there's a great book. It's called Dissolving Illusions. I've got a copy over there somewhere in that pile, but it's written by Dr. Humphreys. It's a great book. It goes through the whole history of vaccination, from smallpox to polio, and it tells you that it's a myth. That's what the name of the book. That illusion that vaccination has been the reason why we have fewer communicable diseases is a myth. But anyway, we won't get into that now. And here's another list of foods. Here again, guess what's right in the middle of that? Curcumin, turmeric. It actually regenerates and preserves beta cells, which make the insulin. Everybody, I think, should be put turmeric on your dining room table and just sprinkle a little bit on everything you eat. Maybe not some things, not dessert, maybe ice cream, but we had stir fry last night. We put turmeric on it. It's great. Take a little bit regularly. You probably won't need big doses later on to cure your cancers. But all these things help. And this is what we need to do if we want to prevent and slow down the progression of any diabetes. Now I added in here, so just kind of for general information, a list of things that, well, put a lemon juice fast. If you wonder, here I say this almost every class, is if you wonder if you have food allergies, you should be able to go 24 hours without eating and still feel okay. You should be able to go on a 24-hour fast and still be quite functional. No headaches, no irritability, no low blood sugar symptoms, no depression. None of those things should occur after going 24 hours without eating. If you cannot do that, it's almost always that you have a food addiction. And if you want to see what symptoms go away when you avoid your foods, go on this lemon juice fast. Then just a few things. 1 tablespoon of sugar is 48 calories, etc. No protein, no fat, no vitamins, no minerals. Straight carbohydrate. Okay. Some other blood sugar control things. Here's all the things sugar does to a person on one of the last pages. Now, if you're a sugar addict, what do you do about it? It's really a challenge because, that's one of the weaknesses I feel of AA, whether we're talking about AA alcoholics or AN or NA or whatever. They substitute sugar for alcohol or drugs. You go to an AA meeting, boy, they got cookies and coffee, and coffee is the other thing. I didn't mention coffee. Coffee accelerates your excretion of all these nutrients. A lot of people just need a hot drink, and a lot of people find that if they just substitute some other hot drink in the morning, they're fine.
Go to green tea.
Pardon?
Go to green tea.
Well, if you like green tea, what if you don't like green tea?
Cocoa.
Your system failed.
I was told that there's you actually just add a small smidge of your natural unrefined salt to your coffee, not enough to disturb your taste of your coffee. Apparently that.
Well, that'll help neutralize the mineral loss, but it won't do anything with the vitamin losses. There's not many vitamins in your salt. You've got to make up your mind. It's all up here in your head. Once you decide, and I think most people are going to have to pray about this and have a sort of a change of heart. Once you decide you're going to quit, some people say, I only drink 1 cup a day. They've been drinking for 40 years. How many gallons of coffee is that? Let's say you lost 1 milligram of magnesium for every cup of coffee you drank. Now, if you just drink 2 a day, that's 700 a year. And if you drink it for 10 years, that's a lot of magnesium. In addition to, anyway.
It also bathes the body in acid. It's acidic.
It makes the body more acidic. And what does that do to your insulin sensitivity? Wake up. Anyway, it increases your need for insulin. You're less insulin sensitive if you're acidic. So substitute baking soda. Warm baking soda, anyway. Okay, so you got to read this over. We like most of these classes are just an introduction to hopefully give you the idea that diabetes is inevitable. It isn't fatal, and my complications aren't irreversible. And just because the doctor said I've got diabetic retinopathy doesn't mean I'm going to go blind. There's things I can do. But there's a saying I really like is called, "Your health is too important to leave in the hands of your doctor." And that's, I think, true. Now, you might need him sometimes, but use a doctor like you'd use a mechanic or a plumber or your telephone repairman. Be smart enough to know when you need him and smart enough to know when you can do it yourself. Can you really need a plumber when there's just a ball of toilet paper in the toilet? Or you get your plunger out? Anyway. Okay, any questions?
I have a grandson that came down with type 1, severe type 1 diabetes at the age of 21.
Yep.
So it's been a nightmare trying to get him to eat properly and pay attention. And he's ended up in the hospital with a 700.
Sugar, yeah.
And
I had an interesting kid once. He's 20, 19, same age group. His blood sugar was running 400, 500, 600, and he was losing his feet. The circulation to his feet was very, very compromised. And he was headed for some sort of a serious complication. He went totally off grain for a week. His blood sugars were normal. But he wouldn't stop.
yeah.
He wouldn't stop. He could see. Intellectually, he could see, yeah. When I eat breads and I eat cookies and things like that, my diabetes is worse, and I'm probably going to lose my feet.
Well, he's going to lose his life, is what
Well,
they keep
eventually.
telling him.
Well,
that,
this is just slower loss of life versus his feet
he
and
ended
it's
up with
his
an
legs.
abscess in his heart.
Well, yeah, there's all these complications. But
So
it's
it's
really, it's a real challenge, and you better be careful. You can alienate him as a person if you keep. He's 21. You can't talk him into it.
No, no.
It's sad, so you change yourself. What's that old Jewish proverb? When I was a kid, I was going to change the world, and then I got to be an adult, and I was going to change my family, and then I got smart, and I figured I better change myself. That's all we can do. Set a good example and be there. Send him a book like this. Maybe he'll throw it away. Maybe he won't.
I try to get him to read that book. And like
No,
I said,
don't try and get him to read it.
I take an article and maybe read this article.
Give it to him and say, you might be interested, and drop it. Don't bring it up.
Well, I
He's-
did that because he was with us for 17 days.
Okay.
Because he was on a drip, antibiotic drip, and I had to help him with that. Anyway, I did take that in, and I gave him one time.
Okay, that's
But-
about all you can do.
And so while he was there, he didn't pick up the book at all.
It's really sad.
But drink pop, oh my Lord, Pepsi. Finally, I did convince him that aspartame was going to kill him if nothing else.
What is he doing now that he's away from your surveillance?
He's with his mother, which is not good.
Anyway, it's sad, and we see that happen, and you change people you can and offer other people hope, but then other people are just going to walk away from you. Anyway, you did what you could.
Well, we're keeping at it. He's,
Any other questions? Okay, great.